How do you know if your fear is realistic or just anxiety talking? Have you ever acted on an anxious thought only to realize later that it was a false alarm? Welcome to Quieting Anxiety by Excel at Life. I'm Dr. Monica Frank, and in today's episode, we're exploring another exposure strategy from cognitive behavioral therapy, CBT. Designing and conducting personal behavioral experiments. These experiments help you test the accuracy of your anxious thoughts and begin to rely on direct evidence instead of fearful predictions. As I explained previously in the introduction to exposure methods, these episodes are for educational purposes only. Exposure is a powerful technique that should be guided by a qualified CBT therapist. Be sure you have listened to episode 37 first, which provides a foundational understanding of exposure treatment. Before we begin today's episode, let's pause and check in with how you're feeling. Take a slow breath in through your nose and release it through your mouth. Again, inhale deeply and exhale. As we start talking about exposure methods, you might notice some anxiety arise. That's okay. It's completely normal to feel uneasy. Even imagining doing something that makes you anxious can bring up discomfort. But here's something important to remember. You're not being asked to jump in or do anything right away. This is simply an opportunity to notice what comes up and to learn. You can ask yourself, what is this anxiety telling me? Can I observe these thoughts and feelings without needing to act on them right now? You're just collecting data. That's it. Let's take one more breath in and out. That's the attitude we're working on. Open, curious, and willing to learn from experience. Anxiety can sound convincing. It insists, if I speak up, people will think I'm foolish. Or, if I don't double check everything, something terrible will happen. These thoughts feel like facts. But what if they're just untested hypotheses? In CBT, we treat anxious beliefs much like scientists treat theories. Something to test, not something to automatically trust. When you test a hypothesis, you gather real-world data instead of relying on what your anxiety tells you might happen. You observe, record, and analyze the results. Did what you fear actually occur? Was it as bad as you imagined? Did you handle it better than you thought? By running these small behavioral experiments, you're doing more than thinking differently. You're proving to yourself that your anxious predictions aren't always accurate. Each experiment becomes a chance to challenge the mind's tendency to overestimate danger and underestimate your ability to cope. It's not about trying to be fearless. Instead, you're learning to say, let's see what really happens. That mindset shift from avoidance to curiosity is what turns anxiety into an opportunity for discovery. And that's exactly what we'll explore in today's episode. How to design and carry out experiments to test your anxious beliefs safely and effectively. So what are behavioral experiments in CBT? A behavioral experiment is a structured activity designed to test a specific belief that's contributing to your anxiety. You're asking a clear question and seeking a real answer. This practice of creating a behavioral experiment is considered a form of exposure because it involves intentionally facing something anxiety-provoking rather than avoiding it. Avoidance is how anxiety maintains its power. When you avoid a feared situation, you never get the opportunity to discover whether your anxious belief is actually true. By designing and carrying out an experiment that tests that belief, you deliberately put yourself in a position of uncertainty and emotional discomfort. You expose yourself to the possibility of being wrong, of being judged, of feeling anxious, and then you observe what really happens. The exposure occurs both in the anticipation of running the experiment and in the emotional reactions during the task itself. You may feel the urge to retreat, to avoid, or to control, but the experiment asks you to remain curious instead. By staying present with the anxiety and completing the task, you help your brain learn that distress is tolerable and that feared outcomes are often exaggerated or inaccurate. In this way, the experiment becomes not just a test of the belief, but a training opportunity for emotional resilience. This is different from other types of exposure therapy. You're not just trying to get used to a sensation of anxiety or embarrassment. You're collecting evidence to evaluate whether your fearful prediction actually holds up in real life. You're shifting from what if to let's find out. By setting up simple, structured experiences that deliberately test your assumptions, you can begin to see whether your fears are grounded in reality or whether they're just habits of the anxious mind. How do these experiments help? Behavioral experiments help build real world confidence, not just the kind of confidence that comes from telling yourself everything will be okay, but the kind that comes from experiencing that you can handle anxiety provoking situations. Instead of just challenging your beliefs with logic, you learn by doing. And that kind of experiential learning tends to be more powerful and lasting. When you carry out a well designed experiment, you often start to spot how your mind overestimates danger. You might think something terrible will happen, but then you test it out and find that the outcome is far less dramatic than your anxious brain predicted. That insight helps loosen the grip of fear. Another benefit is that experiments interrupt the cycle of avoidance. Avoidance keeps anxiety alive because you never get the chance to see whether your fear is realistic. But when you take action and see that your predictions don't come true, or that you can handle it even if they do, you begin to break free from anxiety's control. More importantly, behavioral experiments allow you to discover new ways of thinking based on your own lived experience. This makes the change feel more authentic and believable. You're not just taking someone's word for it, you've seen the evidence for yourself. And that kind of proof can lead to deep, meaningful change. Let's walk through how to design and carry out one of these experiments. Step 1 is to choose a testable belief. Start by identifying an anxious thought that makes a specific prediction. Ask yourself questions like, what belief is keeping me stuck in anxiety? What prediction am I making? Let me give you a few examples. If I don't double check every detail, something will go wrong and I'll be blamed. Or, if I ask someone for help, they'll think I'm incompetent. Or, if I set boundaries, people will be angry with me. These are beliefs that sound logical in the moment, but are often based on past experiences, perfectionism, or emotional reasoning rather than current evidence. Then step 2 is to design a real-life test. Once you have a belief you'd like to test, think of a small action that goes against what you normally do. This action should help reveal whether your anxious prediction actually happens. For example, for the belief, if I don't over prepare, I'll mess up my presentation. You could do an experiment of preparing for the presentation in a reasonable way, without staying up half the night reviewing every possible detail. Then notice what actually happens. Did the presentation fall apart? Did anyone react negatively? Or did it go just fine? You're not trying to prove that nothing ever goes wrong, but you are collecting evidence about whether your fear is proportional to what's likely to happen. Another example for an experiment, for the common belief held by socially anxious people, if I say no, people will stop liking me, can be as simple as saying, I can't do that today, the next time someone asks for a favor. And then pay attention. How do they respond? Do they still treat you with respect? Chances are you'll discover that setting boundaries doesn't ruin relationships. In fact, it can strengthen them. Once you have designed the experiment, step 3 is to track the outcome of the experiment. Before doing the experiment, write down your specific belief or prediction, what you plan to do differently, your anxiety level beforehand on a 0 to 10 scale, and what you think will happen. After the experiment, observe what actually happened. How anxious did you feel? Indicate your anxiety level. And did anything surprise you? Even if things didn't go perfectly, you may discover that the outcome wasn't as bad as feared, or that you coped better than expected. But what if the prediction you feared comes true? Let's say someone does react with mild annoyance when you set a boundary. That doesn't mean your belief is fully accurate. Here's a follow-up question. Was that reaction catastrophic? Often the experiment still teaches something valuable, that you can tolerate discomfort, that you don't need everyone's approval, or that your worst case scenario is survivable. Sometimes we don't change beliefs by finding out we're wrong. We change by discovering we're more capable than we thought. For your reflection this week, consider whether you have any beliefs that could be addressed with an experiment. Ask yourself, if I were to test this belief, what might I learn? If you're working with a therapist exploring exposure methods together, your task can be to discuss how your belief can be tested in real life. What would an experiment look like? If you're not currently in therapy, you can still examine your belief and ask how an experiment could be conducted. If your anxiety is not too high, you could even do a thought experiment and ask what would be the likely outcome, not your feared outcome. Just imagining the process can be a helpful step toward curiosity and change. As we come to the end of today's episode, let's take a moment to settle back into your breath. Slowly inhale through your nose and let the air flow gently out. If you've noticed any anxious thoughts or sensations arising, allow them to be there without judgment. Sometimes, even thinking about change can stir the body and mind. It means you are open and attentive. That's part of the process of healing and learning. Remember, you don't need to take an action immediately. Awareness itself is a powerful first step. Simply staying present with what you feel, even for a few breaths, helps you grow stronger, calmer, and more capable. Let's finish with one more slow breath in and a gentle exhale out. And remember, each time you meet discomfort with compassion, You're teaching your mind that you're safe. Until next time, keep practicing, keep breathing, and keep moving forward.